You're listening to an African Elements top news story for July 22, 2025. Please visit our website at africanelements.org for more daily news. The Affordable Care Act, ACA, known as Obamacare, aimed to make health insurance more accessible and affordable for millions of Americans. Recent developments show a significant shift, with many enrollees facing substantial increases in their monthly premiums. Insurers propose a median premium increase of 15% for 2026, the largest hike since 2018. More than a quarter of insurers are suggesting increases of 20% or more, indicating a widespread trend of rising costs. These increases reflect factors like rising medical and labor costs and uncertainty surrounding policy changes from the current administration and the Republican-controlled Congress. This policy flux forces insurers to adjust rates to account for potential financial risks impacting everyday Americans. A key factor in the projected cost increases is the impending expiration of enhanced premium tax credits, which help eligible individuals afford their health insurance premiums. These enhanced subsidies, implemented during the COVID-19 pandemic, are set to expire at the end of 2025. Their expiration is expected to significantly impact consumers, with out-of-pocket premium payments projected to increase by over 75%. For a family of three earning $110,000 annually enrolled in a Silver ACA plan, monthly costs could rise from $770 this year to $1,446 in 2026 if the enhanced subsidies expire. If the proposed 15% premium increase is also implemented, that monthly bill could reach $1,262. This dramatic increase could lead many healthier enrollees to drop coverage, destabilizing the insurance market by leaving a higher proportion of older and sicker individuals in the risk pool. The current administration and Congress are advancing policy changes contributing to insurers' requests for higher premiums. Insurers are adding extra percentage point increases to their 2026 rate proposals to account for these policy shifts. The domestic policy bill signed into law by President Trump did not extend these subsidies further. Other proposed changes could increase administrative burdens for ACA enrollees. One proposal aims to end automatic re-enrollment for most ACA policyholders starting in 2028, requiring detailed annual documentation on income, household size, and immigration status. Failure to provide this documentation could result in the loss of premium tax credits, making coverage unaffordable for many. Policy experts fear many consumers will become uninsured due to these new requirements. The premium increases and policy changes are expected to disproportionately affect vulnerable populations, especially those relying heavily on subsidies. For marginalized groups, these changes could be particularly devastating. Proposed changes to eligibility for tax credits could create hardship for individuals experiencing life changes needing immediate access to affordable coverage. For instance, new parents might struggle to confirm their baby's eligibility for premium subsidies until they receive a Social Security number, which can take weeks after birth. If too many young and healthy individuals find these requirements burdensome and drop coverage, it could leave a higher proportion of older and sicker individuals in the ACA risk pool, driving up premiums for everyone. The intent of the ACA to provide affordable health care is being undermined by these policy decisions. Additionally, tariffs on medical goods are contributing to rising healthcare costs, with some insurers estimating that tariffs could increase premiums by an average of 3%. These tariffs drive up the cost of essential medical components, which are passed on to consumers through higher premiums. The potential for healthier enrollees to drop coverage due to higher costs poses a significant threat to market stability. While the exact number of individuals who might drop coverage is unknown, experts are concerned that burdensome requirements and higher costs could lead to many becoming uninsured. This could negatively impact the insurance risk pool, leaving a higher proportion of older and sicker individuals and potentially leading to further premium increases. The overall effect is a less robust healthcare system, moving away from the ACA's goals of broad access and affordability. The potential premium hikes and policy changes are expected to have significant political implications. As the nation approaches key midterm elections, rising ACA premiums are likely to invite political pushback. The expiration of higher subsidies would be among the first financial pains felt by healthcare consumers after policy changes from the Trump administration and the Republican Party. Copyright African Elements.